Hello and welcome to the Lullaby Trust. This presentation gives you more information about checking for signs that your baby may be unwell, how to use the Baby Check app, and the importance of vaccinating your baby. Some studies have shown that sudden infant death syndrome, SIDS, may occur against a background of minor illness. Although the exact role of infant infection in SIDS is not well understood, it's recommended that medical advice should be sought if your baby shows signs of illness that carry on for more than 24 hours. If you're worried that your baby is not their usual self, then you can check their symptoms using the Lullaby Trust's free Baby Check app. The Baby Check app can be downloaded from Google Play and the Apple App Store. Each check has a score, and the total score indicates how unwell your baby is likely to be. The app then lets you know whether your baby needs to see a doctor or health professional. When you have viewed the introduction screen, press Begin. You will then be asked if your baby has any of the following symptoms: stops breathing or goes blue, has a fit, cannot be woken, is unresponsive and not aware of what's going on, has glazed eyes and is not focusing on anything, has been badly or seriously injured, has a rash that does not fade when pressed with a glass. These symptoms may be serious, so if yes is pressed, Baby Check displays a message saying your baby may be seriously ill and should be seen by a doctor straight away. The app prompts you to dial 999. If you press No, the app proceeds to the main page. Here you can learn more about how to use the app, when to use it, and how it works. It's advised that you read all the sections before beginning the check. Once read, click Start the check. The app can be used with babies until they are 1 year old. Remember, it's not designed to replace your own judgment. If the check provides a low score, but you're still worried, you should seek medical advice from your GP or NHS 111, for example. It is important to protect your baby from serious life-threatening illness, and vaccinating your baby can provide this protection. Vaccines have a good safety profile, which means that serious side effects are very rare. Research from around the world shows that not only is there no increased risk of SIDS from vaccines, but babies who are up to date with their vaccinations actually have a significant lower risk of SIDS. We advise that you make sure your baby receives all their scheduled vaccinations. It's best for babies to be vaccinated at the recommended age, as they are then protected from serious diseases as early in life as possible. Fever and other signs of illness are common side effects of the 6-in-1 vaccine. It's important not to cover unwell babies in extra bedclothes and to make sure that their head is not covered. So check your baby's chest and/or the back of their neck to make sure the skin doesn't feel hot, clammy, or sweaty to the touch. If their skin feels clammy, it means they're too hot, so remove a layer of bedding or a layer of clothing. Don't use their hands or feet as a guide, as they will always feel cooler than the rest of their body. If babies get too hot, this can increase the risk of SIDS. Vaccinating your baby reduces the risk of SIDS. If you have any concerns or questions about vaccinating your baby, it's best to speak to a trained health professional, such as your doctor or health visitor. Remember, always follow safer sleep advice every time you put your baby down to sleep, during the day or at night. Put your baby on their back for every sleep, in a clear, flat sleep space. Keep them smoke-free day and night. There are lots of places that you can look for advice and support. The Lullaby Trust website and social media have useful information about safer sleep. You can also contact us at the Lullaby Trust directly in a variety of ways. If you have any questions as a result of watching this presentation, then please contact our Information and Advice Helpline or by email. We're also available by telephone or email for bereavement support. There should also be local contact numbers in your baby's red book. Lastly, if you're worried that your baby is ill, the NHS website has lots of information in general about babies and also specific information if you think your baby is unwell. Thank you for taking the time to watch this presentation.